Hi guys, Dr. Cervone here with Cumberland Chiropractic and Sports Medicine. Over the past couple weeks, I've been collecting questions from you, the patients, that you have for us, the doctors. So today, we're going to be answering some of those questions. So I'm going to kind of fire these questions off to these guys. They're going to give me some answers off the cuff. They don't know what's coming. So to see the answers, stick around and hopefully you learn something today. Okay, so the first question is going to be for Dr. House. So how can we help babies and newborns in our office?
Okay, great question. Love it. I've got a couple of little ones at my house right now. So just to give you an example, my daughter, when she was an infant, had some kind of colicky, constipation kind of troubles. Okay, anybody would say, how in the world is a chiropractor going to help? Well, I didn't treat her for colic and constipation. What I did was I treated her like a adult. I palpated, moved different joints of her body. And when moving those different joints of her body, I found that she had a hip stiffness. I believe it was her right side. That hip stiffness would create some kind of tension around her SI joint. So in treating that hip with the same type of techniques, only much more gentle, light, because it didn't require very much force, she got this amazing, like, I hit the button on fixing the constipation. So how do we treat children? We treat them like big people. However, a lot of their symptoms aren't because they have a hip pain, or for that example, they have a internal medicine problem, and we've just seen miraculous results. So that's one of the ways.
Very cool, very cool. Okay, second question is for Dr. Moore. Why do we not adjust the same thing on a patient every single visit?
Okay. So we don't adjust the same thing on every single patient every single visit because they don't have the same problem every time they present. With every patient, when it comes to spinal and joint adjusting, we want to find out what their pain and problem is, kind of where it's stemming from, and then find out where they need that adjustment. Because when we're adjusting joints, we're trying to improve the motion in joints. So it doesn't really make sense to adjust joints that are moving well or maybe even moving too much. We want to hone in that adjustment to joints that aren't moving well, and we find that that gets the best results for a person's pain or problem. It may not even be where they're feeling their pain necessarily, but if we can equalize the motion in the joints through their spine or through the extremity, it typically gets the best results, and that's why we do it.
Okay. Excuse me. Okay, the last question is kind of for everyone here, so we'll kind of work our way down the line. We'll start with Dr. Moore. Do you have a favorite problem or area that you like to treat?
Yes. I like to treat, in addition to neck and back pain, which is kind of every chiropractor's bread and butter, I enjoy treating plantar fasciitis. It's maybe a weird thing to enjoy treating, but I like to see that because I did a lot of running. I ran track in high school. I've done, half marathons, some of the obstacle course runs, and I've always enjoyed running. So I can really relate to people that struggle with foot pain and they want to get back to running. I also do dry needling in addition to chiropractic and a lot of soft tissue techniques. So it gives me a chance to use dry needling on some tough plantar fasciitis cases, and I've just always kind of enjoyed treating that. So.
Good. Cool. How about you, Dr. House?
I'm glad I got this question second, so I had a chance to think. But I was having this discussion that I feel like the Lord sends me this handful of the same exact patient problem all at once. And it's almost like, you better get better at this one. You better get more able to help these people faster. So I'm always evolving on what my favorite would be, because probably my favorite would be the one that I'm learning the most on. But maybe right now, probably one of my favorites is maybe the shoulder. I feel like the shoulder is complicated, especially when we're talking about the bully and the victim, things like that. And we just, we get great results with some people who are probably going to be in surgery with those shoulders if we don't get a chance to help them. So probably shoulders.
Cool. For me, I'd probably have to say headaches. It's kind of the same thing you said. It just seemed at one point I was getting all these headache patients. So I'm spending all my time researching headaches and learning how to treat headaches. And you just get passionate about something when you do that much research on it. And you headaches is one of those things too. You tend to get a lot of relief that day with some patients. Obviously, there's some stubborn ones that hang around as you're treating them, but headaches is one of those things where people get off the table and they're like, wow, that is significantly better, or nobody's been able to help that, and you finally help that. So it's cool sometimes to see that kind of immediate relief when we treat something. So that's our questions for today. Thanks for watching, guys. If you like this video, give it the thumbs up, share it with your friends and family. If you have more questions, we love doing this kind of impromptu, kind of informal Q&A sessions. So leave us questions. Give us questions when you come into the office, and we'll try to make a video and answer them for you. This has been Dr. Cervone, Dr. House, and Dr. Moore with Cumberland Chiropractic and Sports Medicine, where we get you better faster.